Doctors, what is a medical question a friend has asked you that you wish they hadn't? As a second-year medical student, I get approached by family and friends at least twice a month to interpret lab work, imaging reports, and even diagnose symptom patterns. I usually don't mind, but it always happens at the worst possible times, when I am cramming for an exam, sitting in class, or deeply immersed in a healthcare setting. Recently, I visited my parents, and a family friend had just dropped by. Without hesitation, they shoved a phone in my face with my chart results displayed, expecting me to interpret imaging in labs before their doctor had even contacted them. I held my tongue and politely refused, even though their degenerative spine condition was a complete mess and had already progressed to requiring surgery. On the other hand, my atopic sister just sent me a photo of a rash on her arm. I probably receive half a dozen such requests from her each year. The diagnosis is usually the same, but since she's my sister, I don't mind helping. It's fundamentally bad medicine to make a diagnosis without performing a thorough clinical exam. I despise attempting to determine a diagnosis from just a CBC or a blurry phone picture. Proper evaluation requires seeing the patient and including a hands-on physical exam before drawing any conclusions. Some cases are straightforward, black and white, but most exist in gray areas where nuance, context, and the subtleties of human physiology are crucial. There's an art to medicine, and these human elements are why we could never be replaced by AI or some 2-bit language model. We are nowhere near AI singularity. By that point, many jobs might be replaced by AI, but the art of patient care is far too complex to automate. The worst situation I faced personally was watching my favorite aunt slowly develop dementia. I recognized the signs about a year before she was officially diagnosed, and we gently encouraged her to see a neurologist. She delayed for months, and when she finally went, the diagnosis was confirmed. My cousins became frustrated and attempted all sorts of retroactive but ineffective remedies and lifestyle interventions, hoping to reverse the inevitable. I couldn't bring myself to tell them the harsh truth, that the disease is irreversible. I knew they should focus on quality of life, cherishing time together, and planning for advanced directives and care decisions rather than hopelessly relying on crossword puzzles and word games. They peppered me with questions, but then ignored much of the medical guidance I offered, which was incredibly frustrating. I want to clarify my perspective, and this is partly a cathartic ramble. I enjoy being helpful and translating complex medical information into simpler terms for the people in my life. It's a passion, and a way I feel I can make the world a better place. But there must be limits. First, I am not far enough along in my training to be giving definitive answers. There's a reason physician education and residency are so intense. Years of study, thousands of hours, and countless details across medicine that go far beyond a college degree, a master's, or a mid-level online program. There is truly nothing like it. The intensity is almost overwhelming. I must be genuinely out of my mind for choosing this path, sacrificing my 20s and early 30s, and accumulating over $300,000 in debt plus interest, all for the chance to pursue what I love. I'm only 2 years into an intense training pathway, but I have at least 6 more years ahead, including 3 stages of board exams, thousands of residency hours, even more for surgical specialties, dealing with insurance bureaucracy, hospital administration, and a grueling schedule of 60 to 80-hour work weeks with back-to-back nights and weekend call. It's bonkers, unquestionably unhealthy, and I must be genuinely insane for choosing this path, but it's what I want to do, freaking stupid as it might sound. Imagine dedicating years to study and training, only to realize that no matter how much you learn, you still cannot know everything. The more I learn, the more I question whether I have what it takes to conquer the countless unknowns I haven't even realized exist. The pressure we place on ourselves to be perfect in a field where perfection is impossible is immense. It is truly a lifetime of learning and revising. So please, cut me some slack, Jack. Second, the medical profession is governed not only by law, but also by a strict code of professionalism, ethics, and moral responsibility. Even when the law is vague, there are professional standards and oaths we must uphold. As a physician, I will be both legally and morally accountable for patients under my care. I am ethically obligated to preserve the patient-physician relationship, yet any interaction outside a formally established care relationship is not legally protected. If I cannot provide care directly, I am morally, legally, and ethically bound to either transfer care through referral to another physician or assist the patient in obtaining emergency medical attention. Story 2. This turned into a longer story than I expected, but sometimes the small details reveal the bigger lessons about life and health. I think we're just raised to feel indestructible. Any sign of mental or physical weakness is supposed to be suppressed, or somehow you're worth less as a person. Your value seems to come from strength alone. Of course, we mostly are indestructible in our teens and 20s, which doesn't help matters. That mysterious pain probably is really nothing. You can pound 10 beers and be good to go the next evening, and generally speaking, work hasn't had the chance to crush your soul yet. Pulled a muscle? Give it a day or two. Upset stomach? Drink some water and power through. Lost your job? Move back to your parents' place and apply again. Bad mood? Go see your friends, play a video game, hit the gym, whatever works for you. You're also far more likely to have a large support network, family, friends, and so on. What I notice with my friends, now in my late 30s, is that they struggle to accept their physical limitations. That sprained ankle, strained groin, pulled hamstring, or bad back tends to stick around longer, so people push through it and often make it worse. Similarly, there's a lot of comparison, frustration, and the realization that while life felt fair in your 20s and early 30s, where hard work usually paid off, you're now being managed by people who kiss the right boots and don't actually know what they're doing. Your dreams of writing a novel, becoming an actor, traveling the world, or starting a business feel increasingly distant because more responsibilities are taking up your time now. You could have pursued them at 25, but you needed money, wanted to develop a career, or simply weren't ready. When you're a woman, or at least from my perspective as a man, you start dealing with all sorts of medical issues basically from puberty onward. What's normal, what isn't, cycles, discharge, and so on. By the time you're 25, suddenly it's, yeah, we need to check you for cancer every couple of years, and you're virtually guaranteed a health scare at some point. Bonus points if pregnancy ever enters the mix. There's also the added responsibility of managing contraception and all the other layers of intimate relations. It seems exhausting to be a woman, but it's exhausting from the start. Vulnerabilities are more accounted for, and girls are encouraged to seek medical advice early because things can and do go wrong, and puberty's spectrum is wide and unpredictable. Likewise, society generally looks to women to nurture rather than provide, at least compared to the typical expectations for men. Caring and nurturing are something that develop with age. With guys, it's more like, sweet, I can grow a beard now, I'm stronger, and yes, there are expectations, but crap, I can achieve them. I can stay up all night, lift heavy objects, and engage in intimate relations as much as I want. You're probably always improving in some way. But it gets more exhausting as we age because the world still has expectations of us, and we now have expectations of ourselves as well. We know what we're capable of, and any physical or mental flaws feel like an admission that we're on the downhill slope away from those capabilities. So I can go to the doctor and say, hey, I'm not the man I once was, while also violating the unspoken code of be strong, be stoic, provide, don't be a drain. Or I can shrug it off with, hey, it's probably nothing, because based on my lived experience, it almost always was nothing, broken bones aside. Eventually, of course, it will be something. But that inevitability always feels far off, and on your best days, you still carry the energy and resilience of that bright-eyed 25-year-old version of yourself. Story 3. About a year ago, my mom started dealing with some pretty persistent and uncomfortable symptoms, and because she is a classic nightmare patient who avoids doctors and ignores instructions, it quickly became worrying. My partner, who is a physician, gently convinced her to see her doctor and offered the least traumatizing possible explanation for what might be going on. When the labs and imaging came back, I had her send the results to me so he could take a look, since our local healthcare is notably spotty with availability. I am not in the medical field, but being around him for years has taught me enough to recognize that some of the flagged items in her results were not great. I tried very hard not to interpret anything on my own, but I still Googled what looked like the most concerning result before giving everything to him. When I finally handed him the reports, he asked a few questions about her health history and then said, "I will tell you this. Out of all the cases I have seen in the OR, this is one of the most dangerous to operate on and has a very high chance of resulting in death." It might sound insensitive to share such a heavy possibility, but I know he said it because he genuinely cares and refused to downplay the severity of what he was seeing. I honestly love him even more for being so professional and compassionate. After he talked to me, I called my mom and explained how serious her results were, telling her she needed a real come-to-Jesus moment about her lifestyle choices. Specifically, I told her smoking is going to end her life faster than she realizes. Her official diagnosis from her own doctor, abdominal aortic aneurysm, and her blockage is significant enough that using basic probability, without lifestyle changes, she would deteriorate and increase her risk to, well, not very good odds at all. He explained that quitting smoking, exercising, and improving her diet could slow or even reverse parts of the progression, giving her a better quality of life and hopefully a longer life too. My mom has not quit or even cut back on smoking, refuses to exercise, and has made zero changes to her diet. It frustrates me deeply and makes me genuinely sad because I wish she were less stubborn. Every time she lights a ciggy, I remind her she is one puff away from ending herself or being stuck in an uncomfortable medical limbo until the inevitable. Her response never changes. If it's my time, it's my time. Positives have come from this, though. She and my dad have updated all their affairs, so at least that part is sorted. It has also inspired me to keep pursuing the healthiest lifestyle I can and to appreciate the time I get with the people I love. She's right that eventually it will be my time for all of us, and none of us controls that part. But I still want to live fully, happily, and healthily for as long as I can. Please don't be a stubborn patient or give up on your life, no matter your age or diagnosis. People love you and want you here for as long as possible. Story 4. You set in motion her path to treatment and gave her family clarity, something I would never wish upon anyone, whether it be Lewy body dementia or any form of aggressive, relentless cognitive decline. I was a caretaker for the husband of a couple that had been together for 60 years. He was an Eagle Scout, a mathematician, a polka musician, a devout Baptist, and the father of 6 wonderful grown kids. He wanted to be a teacher, but it did not pay enough to raise a family, so he sold insurance. I got a peek at their investment statement, and they had millions, but lived very conservatively in a neat, small home. He had Alzheimer's for 10 years when I met with them. They were the sweetest, loveliest, most grateful family I ever worked for. His wife knew what he needed or wanted just by his eyes, and knowing him for so long. He had been nonverbal for many years prior, and I'm told he was not much of a talker outside work and church. All his kids took part in his care coordination, and they all had to come to an agreement based on what their father would have wanted, not personal feelings. Most were daughters, and he expressed early on that he did not want his daughters to have to clean his special area. He wanted to maintain his modesty as much as possible. His wife had the typical white-haired perm helmet hairstyle that she could not change because he would not recognize her, run away, get upset, or scared. She was the kind of wife that I wish I could be, in the old-fashioned way at least. She was kind, generous, careful, considerate, understanding, honest, and strong-willed, and she took no funny business. She knew him so well because they were friends as well as partners. She told me so much about him that my heart was invested, and I was crushed but relieved for the family when he passed on. I spent his last days with her, and even though I was not supposed to, I did not charge them or punch in. I wanted his family to focus on their closure and their father, rather than medications, intervals, and general care. His wife did not want him to be zoned out or heavily medicated from the hospice prescriptions, but I could tell in his eyes that he was either scared or in pain. So I advocated following the protocol, and his children agreed. She just did not want to let him go. He finally succumbed to pneumonia, as many end-stage dementia patients do. From that experience, I learned 2 things about my own end-of-life care. 1. I will absolutely involve my family in my decisions as much as they want to be involved. 2. If I get diagnosed with dementia or any progressive disease that will require 24-hour care, I will take my leave on my own terms while I am still of sound mind. Hopefully, by the time I am old or get such a disease, they will have options that are not so taboo. God will just have to forgive me for not putting my family through that. Story 5. I'm not a doctor, but I had one of the hardest conversations of my life with my little cousin, who was 13 at the time. He was born with underdeveloped kidneys and diagnosed with chronic kidney insufficiency when he was just 2 months old. Doctors predicted that he might survive with only medications until around 5 years old. Somehow, he lasted until 13, when dialysis became his only viable treatment. His mother was never supportive. She would just shut down, leaving the rest of the family to pick up the pieces. I will never forget visiting him in the hospital the day they told him that dialysis or a kidney transplant were his only options. He asked me, in all seriousness, "What is dialysis?" I explained it carefully, choosing my words with caution. Then he asked, "Does that mean I have to do it my whole life?" I didn't want to lie to him, but I also couldn't crush a 13-year-old who had already lost his father, had a detached mother, and now faced life tethered to a machine 3 times a week. I told him dialysis would only last until he received a new healthy kidney, and I hoped it would happen soon. Children always have priority. I reassured him that no matter what, he had our love and support through it all. He then asked, "Who will give me the kidney?" His mother refused, too afraid to undergo surgery, and others either didn't match or weren't healthy enough. That meant he was placed on a waiting list. I didn't have the heart to explain the full reality, so I told him a story. Sometimes there are generous people willing to help others by donating their kidneys, without any suffering or dying involved. I will never forget crying outside the hospital, but I never let him see my worry. He trusted me completely because I never lied. My stories simply left out the harshest parts. His mother never gave him that kind of emotional support, and it became so well known among the staff that whenever I visited, whether to bring clean clothes or just check on him, they always let me in. Doctors and nurses understood how unstable his mother was, and they trusted me to help him feel safe. He was an extraordinarily empathetic child. I forgot to mention that he cried once because he didn't want anyone to give up a kidney for him. He felt it would be wrong to take something from someone else just to save his own life. Sadly, he passed away 3 years later due to complications from the transplant surgery. Over those years, we had many difficult conversations, and his passing remains one of the hardest losses of my life. In many ways, I was more like a mother to him than a cousin. Our age gap was only 13 years, and losing him left a permanent mark on my heart. Story 6. I'm not a medical professional, but I've spent a lot of time shepherding my parents through 2 particularly frightening health events. In both cases, it took relentless advocacy on my part to ensure they received proper care and follow-up. On at least one occasion, my persistence, asking detailed questions, requesting thorough explanations, and refusing to let a doctor hand-wave past providing a rationale for a treatment, led to the medical team changing their course of action. To be clear, I had no specific plan or authority to decide what should happen. I am very much not a doctor, but the simple act of making them walk through their reasoning made them reconsider. I would have given anything to possess the medical knowledge to feel confident that I was asking the right questions. I operate on the assumption that healthcare workers are competent, but often overworked and trapped within bureaucratic systems that mandate procedures in ways that are sometimes illogical or broken. The result is that patients and families must often self-advocate, sometimes at moments when they are least equipped to do so. For example, my dad received cancer treatments at what is supposedly the world's leading hospital for his particular diagnosis. The treatment itself was excellent, but he was forgotten at least 3 separate times. Once, he was left waiting for 2 hours because the system incorrectly reported to the doctor that he had not shown up for his appointment. Another time, follow-up calls left him with an out-of-service callback number, and it took hours on the phone to reach the correct contact. Getting through to your doctor is nearly impossible these days. Finally, a few weeks after his treatment, his doctor relocated to the West Coast, and the hospital failed to assign him a new physician. It took nearly 3 days of persistent phone calls to ensure someone was responsible for his follow-up testing and care, and it only happened because I noticed the lack of communication and questioned it. I suppose there is some hope in the fact that medical professionals can trust their colleagues to catch issues and follow through, even when instincts signal otherwise. I cannot imagine that level of trust myself. So far, my experience has been that the healthcare system often constrains doctors, leaving them with little room to consistently make thoughtful, individualized decisions. Story 7. I'm not a doctor, nor am I a patient with a dramatic medical story of my own, but I love sharing my Grandpa Earl's story because it is absolutely astonishing to me. He served in the military for many years and saw combat, though, like most veterans, he rarely talked about where or what happened. After retiring from the military and meeting my grandma, he was involved in a serious car accident. At the time, he didn't think much of it and didn't appear to have any immediate side effects. When he went to the doctors, they didn't notice anything major either. Over the following years, however, his health steadily declined. His fingers started locking. He lost full control over them. His hands went numb at times, and his neck hurt constantly for reasons he couldn't understand. He couldn't even lie down in a bed comfortably and had to sleep in a recliner. Eventually, my grandma convinced him to go back to the hospital. You know how we men can be: prideful, stubborn, and reluctant to admit when we're hurt. When the doctors finally did proper scans, they were completely baffled by what they saw. It turned out that during that car accident, my grandpa had actually broken his freaking neck, and somehow, when he first went to the doctors, it was completely missed. He had lived for over 8 years with a broken and then improperly healed neck. By the time the issue was caught, there was permanent damage to his neck, muscles, and nerves. He never regained full control of his hands and still experienced persistent neck pain. That didn't slow him down. Grandpa continued to work in his garage, making exquisite wooden cars. He made one for my grandma, 3 for each of his daughters, and 8 for his grandkids. He loved working with his hands and enjoyed watching baseball, particularly the Indians and the Reds since we're from Ohio. He passed away in 2013, and I often reflect on this story, amazed by how tough and resilient he was to endure so much over his life. I also carry this story as a reminder to keep my ego in check. Pride can be dangerous when it keeps us from seeking help. If something feels wrong with your body or health, there's no point in risking your well-being. Get checked. Life is too precious to ignore warning signs. Story 8. I'm not a physician, but I am a generalist clinician with enough knowledge to recognize serious issues outside of my own specialty. My family has always come to me about their own or other relatives' medical conditions, and I often chime in when I feel I can help. However, I am very deliberate about maintaining a healthy and productive boundary between what I verbally offer and what I am truly thinking. My family never realized how asking me for medical advice could negatively affect their health or our relationship until my younger sister was diagnosed with ITP. Just before her referral to a hematologist and eventual diagnosis, she asked me to review her labs and other medical records and tell her what I thought. When I did, everything screamed some form of advanced lymphoma or another malignancy to me, and internally I was melting down at the thought that my sister might suffer and potentially die prematurely. Externally, I downplayed it, explaining that her specific abnormal lab values were non-specific and didn't immediately suggest an emergency, even though in my specialty they would have. It wasn't until she was healthy and stable that I shared what I had experienced while trying to do her a favor. They had no idea that I had to carefully balance steering her toward the right level of care, despite not fully knowing what that should be, while avoiding anything that might undermine her trust in the physicians caring for her. I simultaneously didn't see any critical issues with the care she was receiving, feared unintentionally undermining my family's trust in the professionals, and was terrified they weren't giving her the attention I thought she deserved. In the end, everything worked out. When I explained the internal stress it caused me, they were genuinely floored. Now, they better understand that I am a valuable resource, but I cannot effectively direct their medical care unless they end up in my workplace without alternatives. Regardless, I am grateful that my family now has more awareness and respect for the importance of maintaining a clear boundary between family members and patients. Story 9. I do feel like your situation is somewhat different from what I experienced. The major difference is that I was not in a position where I was asked or expected to shepherd my sister through the healthcare system. She is fully capable of advocating for herself and wouldn't need me to point out situations where her physician's office might have made errors. I would actually feel fine acting as a healthcare system navigator for a family member if asked. But that wasn't what was being requested of me. I was essentially being asked to give my own diagnosis or insight into how severe her condition was. As soon as I began gathering information, I immediately realized that something serious was happening. What exactly it was, however, was far outside the scope of my training and specialty knowledge. Telling her anything beyond what I did would have terrified her, and I didn't want my input to conflict with her seemingly competent care team. If it had, it would have been difficult to reassure her that the recommendations she was receiving were appropriate, because my own assessment would have required an entirely different approach to her care. In essence, I was on the sidelines, not in a position to direct anything, but what I said could completely change how my sister chose to engage with her care. If I had simply said, "I have no freaking idea what's happening with you," or refused to participate at all, my family might have interpreted it as me ignoring her or not caring. The situations you describe are similar to those I encounter with my own aging parents' medical care and even my own. How you seem to have navigated those issues is exactly how I would have approached it. Keep being their advocate. They genuinely need your involvement, and it sounds like you are doing a fantastic job in that role. Story 10. When my father-in-law was diagnosed with cancer, the family started sending me his CT scans, labs, and other reports, expecting me to interpret them. Absolutely not, especially in situations that are emotionally intense like that. I spoke frankly with my husband, who is accustomed to blunt medical conversations, and made him promise not to relay any information to his family. They needed to hear it directly from his care team. My entire family works in medicine, spanning multiple specialties and practice areas. Our discussions, I've come to realize, are very different from most people's dinner table conversations. When it comes to medical matters, we tend to be blunt and precise. I am the only medical professional in my husband's family, and I refuse to offer opinions to anyone there. I've seen firsthand how patient families can turn on the one person with medical knowledge in their midst if things go badly. I was not willing to be that messenger and risk family tension or anger. The only exception was when my husband had an uncle hospitalized for a temporary but severe illness. His mother and aunties were thrilled that he had a successful surgery and was improving. We all went to visit him, and on the way home they turned to me and asked what I thought. I was young, and without thinking, blurted out, "He'll be transferred to the ICU by tomorrow. He looked awful." I was completely correct. That night at 10, he was moved to the ICU. He stayed there for another week before transferring out and genuinely improving. His mother was impressed and thanked me for the warning. The other aunties, however, were frustrated that I couldn't somehow prevent it from happening just because I knew what was coming. Story 11. Be cautious of diagnoses of exclusion. Just because a doctor cannot immediately identify what is wrong, it does not mean that nothing is wrong. For nearly 2 decades, I reported to various primary care doctors, switching insurance several times, that I experienced extreme discomfort in my chest. I could only describe it as having my breath suddenly squeezed out of me, though it lasted only a second. Sometimes it happened just once, but often it occurred repeatedly, to the point where I could not focus on my work. Each doctor would order an EKG, and when the results came back normal, they would dismiss it as anxiety or panic attacks, prescribing antidepressants I never took. 2 years ago, a brand new primary care physician referred me to a cardiologist for a stress test. By sheer coincidence, one of those episodes occurred while I was hooked up to the monitor, and it appeared clearly on the trace. I pointed to it on the screen and asked, "Is that what a panic attack looks like?" The cardiologist explained that it was actually a PVC and noted that I was experiencing a large number of them. After wearing a monitor for a month, they discovered I had as many as 10,000 per day. It still frustrates me how, for decades, I was dismissed as simply anxious or suffering from panic attacks. The experience taught me that persistence matters and that patients must trust their own observations, even when the system repeatedly fails to listen. Story 12. I have a reflection. When my sister was in the final stages of cancer, she was lying to everyone, including her doctor, about how she was really doing because she didn't want chemo to stop. She was also in deep denial about her impending fate. A friend who came to stay with her for a few nights was alarmed by her extremely deteriorated state. Complete urinary incontinence, barely able to walk without holding onto the wall for support. It was so severe that the friend insisted she go to the hospital, and in doing so became, in social work terms, the disposable person, the bearer of truth and devastating news. The friend explained that they acted knowing my sister would likely never speak to them again. They saw her behavior putting her at serious risk and knew I would be arriving the next day, so they wanted to spare me from walking into that reality unprepared. Perhaps, in that context, being the person who calmly recognized the terrifying medical truth simply placed you in that same role, the messenger of reality. My sister passed away within the week, but my friend's decision to call 911 and get her to the hospital actually allowed her to have the best possible death under those difficult circumstances, a death that she wanted but could not have faced on her own. Today is her birthday, and we both hope that this reflection brings some perspective and comfort to you. Story 13. This actually happened to me. I'm just an OBGYN PA, but about 5 months ago, I had an emergency C-section due to severe preeclampsia with my twins. I had to insist that they test me for preeclampsia because they initially said I only had trace protein in my urine and my blood pressure was in the 140s over 100 range. I lost 3 liters of blood, and I think I only survived because I trusted my instincts and spoke up when I knew something was wrong. During the C-section, I began feeling dizzy and repeatedly told the anesthesiologist that something was off. Soon, I started losing my vision and hearing and could barely whisper, "Feel bad," while overhearing them report that my blood pressure had dropped to 70 over 40 as they performed fundal massage and blood poured out of me. The medical team quickly administered TXA, Hemabate, and misoprostol, but the bleeding wasn't stopping. I asked if I might need a hysterectomy, and while the doctor was elbow-deep managing clots, they reassured me I would be okay, which gave me a small measure of hope amidst the fear. They eventually placed a JADA device for 24 hours to control the bleeding, and I received 6 blood transfusions. The entire experience was terrifying and surreal. I was fully aware of the danger, yet had to rely on both my instincts and the team around me. In some ways, I wish I hadn't known exactly what was happening. But if I hadn't been so alert and vocal about my symptoms, I likely would not have survived. This experience also reminded me how crucial it is to trust your body and speak up, even in the face of professional authority. Your voice can literally save your life. Story 14. Some situations feel impossible to navigate. The 8-centimeter brain tumor was actually 8 millimeters and benign. Person you've never heard of before is in the hospital. Can you check in on them? Requests. The tremor of a 30-year-old at a dinner party after too much coffee. I'm a trainee. I can't just pull someone aside and review them properly in a clinic. None of these scenarios is inherently complicated, but I can't summon a neurosurgeon over the weekend while I'm 100 kilometers from work if it's supposedly an 8-centimeter tumor. The patient who looks terrible on their first day of admission doesn't want their friend's son wandering in. Overfamiliar, trying to make friends. And the tremor of that 30-year-old? It's worse when everyone around is watching. Give me the new multiple sclerosis diagnosis in your best friend, the new Parkinson's diagnosis in your father, and the 8-centimeter brain tumor. I want to help, but don't trap me into evaluating someone without a private clinic space. Even simple situations can go wrong in countless ways. You wouldn't expect an electrician friend to fix your wiring at a party without any tools. Medicine isn't any different. Story 15. Night sweats are nothing like just being a little sweaty while asleep. You literally drench the sheets. You could sleep on a towel, and it would be soaked through around your neck and back. I found myself waking up in the middle of most nights, changing my pajama top and putting down a towel to stay somewhat dry. I'm currently in remission from acute lymphoblastic leukemia, and night sweats were one of my first major symptoms. Other warning signs included extreme fatigue, going to bed at 7 p.m., and happily sleeping through until 9 a.m. most nights, only to still feel too drained to work. I'd suddenly get out of breath climbing hills that were never a problem before. Minor infections started popping up on my skin, like pimples that needed antibiotic cream just to heal properly. The biggest red flag was a blood clot in my right leg. The symptoms from that are what made me finally go to the doctor and set the diagnostic process in motion. Basically, all of my blood counts were seriously off. Platelets and hemoglobin were dangerously low, and there was an insanely high number of immature lymphocytes. If you're worried about anything like this, a basic blood test would absolutely reveal if something is wrong. Don't ignore your body's signals. They can be life-saving. Story 16. Triple-negative breast cancer, TNBC, is aggressive, but there is now excellent treatment available, and survival rates have improved dramatically over the past few years. In just the last 5 years, scientific advancements have significantly changed the outlook. Of course, outcomes depend heavily on individual cases and the stage at which the cancer is diagnosed. Many women with TNBC can be treated successfully and reach NED, no evidence of disease, without it ever returning. I share this as both a TNBC survivor and someone in the medical field, mainly so others who may come across this thread can see that a diagnosis today is not always a death sentence. This is not to question or invalidate any personal decisions you may have made. For context, I didn't carry the gene mutation and still developed TNBC, so sometimes there are no guarantees. One of the first things my surgeon and oncologist told me was that the survival statistics commonly found online are usually out of date, as it takes time for results from new trials to be published. Wishing you all the best with your double mastectomy. Story 17. I'm a hospital volunteer, no clinical training, but after spending years on medical floors and asking staff countless questions, I learned a little about how things work. Occasionally, I could help clarify or correct misconceptions that left patients or their families scared or anxious. To be clear, I never gave specific medical advice. I always made sure to tell them that I wasn't clinically trained and that they should confirm everything with their nurse or doctor. Often, I would even suggest how to ask, because I quickly learned that phrasing made a big difference. Something as simple as the volunteer said, "Is that right?" gave patients the confidence to speak up. People would approach me because a volunteer feels less intimidating than staff, and by answering questions matter-of-factly, I helped them feel that their concerns were valid. When they then asked their nurse or doctor for clarification, it signaled to the staff that they truly wanted to understand, which often made the conversation easier for everyone. It was a small role, but I felt proud to help facilitate communication and understanding, giving patients and families a bit more confidence in navigating the hospital. Story 18. My wife had a cloudy spot on a brain MRI. The doctors told us it was likely some kind of astrocytoma, a type of brain tumor. Unsure and anxious, I reached out to my best friend, who is a radiologist, to help me make sense of it. He explained that there are 4 grades. Grade 1 is most common in children. Grades 2 and 3 are distributed randomly in the population. And grade 4, he joked, usually appears in old white guys. And if you get it, it's essentially game over. We laughed, trying to ease the tension because my wife was definitely not an old white guy. I held on to hope that it would be grade 2 or 3, the type of surgery and chemo that can sometimes be managed. A week later, the biopsy results came in. My wife had grade 4 glioblastoma multiforme, the kind that repairs itself quickly even after chemo, with an average life expectancy of around 18 months. The next months were a mix of hope and heartbreak. She faced every treatment, every doctor's visit, and every challenging day with courage I could hardly comprehend. We celebrated small victories, a good scan, a symptom-free day, and clung to each other during the painful ones. I watched her strength shine even as the illness took its toll. She fought bravely, lasting nearly 18 months predicted, before passing away. The experience was devastating, but I am grateful for every moment we shared. My friend's earlier joke now seems bittersweet. His no-nonsense way of explaining the situation never softened the truth, but it never broke the bond we had either. This story is a reminder of how fragile life can be, how important honesty is, and how love and courage can carry us through even the hardest journeys. Story 19. In medicine, we're taught to never treat friends or family. Even if you had no choice in the situation, and even if you ended up saving that person's life as the messenger, you will always be associated with what the message meant, their health loss, and the pain they had to endure. I am a doctor, and I take this very seriously. People naturally ask about health concerns that may seem minor to them, but I try to avoid getting too medically involved with those I am close to. For your friend, the question might have seemed simple. Maybe they expected advice about diet, stress, or lifestyle, but in reality, they put you in an impossible position, one where you cannot come out without being the person who delivered news about something as serious as cancer. Don't beat yourself up. These situations happen in this field, and sometimes There is simply no way to avoid them. Story 20. I'm not a doctor, but I am a paramedic, and I think this story fits the topic perfectly. A few months ago, my parents called me in a bit of a panic because my dad was feeling dizzy. He was lying down at the time, and they had already checked his blood pressure, which seemed normal to them. As I started asking the usual questions, the ones I would ask for any patient, he seemed generally alert, coherent, and calm, so I kept probing gently. I asked him to sit up so we could check his blood pressure again, just to see if positional changes were a factor. The result was noticeably low. I asked a few more clarifying questions about how he had been feeling throughout the day, what medications he had taken, and if there were any new symptoms or changes in his routine. He hesitated for a moment, fidgeting, and then finally blurted out something that made me pause. He had taken Viagra, and the dizziness had started right after he and my mom were intimate. That moment immediately put everything into context. I knew the medications he was on, both his newly prescribed blood pressure medication and an anxiety medication he used as needed, could lower blood pressure, but he had never taken both on the same day before. The combination, along with Viagra, which also affects blood pressure, created the perfect storm. It was no wonder he was feeling dizzy and lightheaded. As a paramedic, I had to quickly think through the potential risks. Walking around in that state could have led to a fall, serious injury, or worse if he had experienced a sudden drop in blood pressure while standing. I calmly explained to my parents what was happening, emphasizing that it was the combination of medications and the timing that likely caused the episode. I also advised them on how to monitor his blood pressure and what steps to take if he felt dizzy again. The relief in my mom's voice was immediate, and I could hear the tension in my dad start to ease as he realized the situation wasn't as dire as he had feared. Even though the situation was resolved without any harm, the knowledge I gained that day was uncomfortable, to say the least. I could have gone my entire life without knowing the intimate details of my parents' personal lives, but in this case, it was necessary to prevent a serious medical event. It was an unusual and awkward intersection of family dynamics and medical responsibility, where my professional knowledge collided with deeply personal family matters. Over the next few days, I made sure to check in on my dad, helping him adjust his medication timing and emphasizing the importance of spacing out doses that could affect blood pressure. I also had a conversation with my mom about how these interactions, while uncomfortable, were sometimes unavoidable when it came to preventing serious health risks. They both understood, though there was a shared acknowledgement of the weirdness of the situation. What this experience taught me, more than anything, is that being a healthcare provider, even in a paramedic role, doesn't come with boundaries when family is involved. Sometimes you are forced into situations where your medical knowledge intersects with very personal aspects of life, and the responsibility of guidance falls squarely on your shoulders. It also reminded me that even small oversights in medication timing or combinations could create dangerous situations, especially when sexual activity is involved in older patients on multiple prescriptions. Ultimately, I was grateful that I could help before something worse happened. I helped him avoid fainting or accidentally taking the medications together again without proper spacing. I also realized that I had to mentally compartmentalize this information. It's not something you casually share with friends or extended family. It's private, awkward, and deeply personal, but it was crucial for keeping someone safe. That day, I became acutely aware of the delicate balance between being a family member and a healthcare professional. It was messy, uncomfortable, and at times cringe-inducing. But I was glad to be the person who could step in and prevent an accident. Still, I would happily go the rest of my life without ever needing to know the intimate context of my parents' lives again. It's one of those experiences that reinforces the strange, challenging, and sometimes uncomfortable realities of being both a healthcare provider and a loved one. Story 21. A few weeks ago, my mom called me with some news that immediately tightened my chest. My favorite uncle had been diagnosed with leukemia. She had learned this from my aunt and, rightfully, felt it would be insensitive to ask about the prognosis directly in the moment. Instead, she asked me what I thought, what the prognosis might be. It's the kind of question that no one wants to answer, but as a medical professional in the family, it fell squarely on my shoulders. I had to carefully navigate being honest without crushing her hope or my own. Let's just say the prognosis is certainly not great. Adding to the weight of the situation is that I live out of state. I'm in the middle of finishing my medical training, and my schedule is packed. Realistically, I don't know when or if I'll even be able to see him before things potentially worsen. I could feel the heaviness of my responsibility pressing down. My mom was asking me to interpret something I could only partially assess from afar. I told her, as carefully as possible, well, it really depends on his biomarkers and the specific treatment he'll undergo, both of which I'm unsure of. It was intentionally vague. Even if I had more information, or if I could make more educated guesses, it's still just statistics at best, and they may or may not hold for him. I wanted to avoid giving her a false sense of certainty, but I also couldn't leave her in complete fear or confusion. I thought about my dad 10 years ago. He had been told he had 3 to 5 years to live after his diagnosis, but he passed away in just 4 months. I couldn't bring myself to give my mom that kind of false expectation again, or the heartbreak that comes with it. In moments like these, numbers are dangerous. They can give the illusion of control where none exists. As I spoke to my mom, I could feel the tension in her voice, the need for reassurance mixed with the fear of the unknown. I wanted to tell her everything I knew, but part of my medical training and personal experience tells me that being blunt with incomplete information can do more harm than good. Even as a doctor or someone in the medical field, I had to walk a fine line between honesty and empathy. The conversation reminded me why we are often advised never to treat friends or family without extreme caution. Medical questions asked by those we love carry weight far beyond the clinical answers. When my mom asked about my uncle's prognosis, she wasn't just asking for information. She was asking me to hold her world together for a moment, to translate raw, frightening data into something digestible. And in doing so, I became the messenger of a reality none of us wanted to fully confront. It's an awkward, almost cruel intersection of roles. I am a family member, yet my training makes me a quasi-authority in her eyes. Answering the question required tact, restraint, and the knowledge that sometimes silence or vagueness can be more protective than blunt honesty. I gave her what I could, but I also carried the emotional weight of the unknown, knowing that my uncle's life might take a turn, before I could even be there in person. By the end of the call, we had reached a fragile understanding. She knew I could not give her certainty, and I knew she needed my words just the same. I hung up the phone with a mix of relief and sorrow, recognizing that being asked a medical question like that, by someone you love, is both a privilege and a burden. This experience reinforced a truth I've learned repeatedly in my medical training and life. Sometimes, the questions we wish we hadn't been asked aren't about curiosity. They're about trust, expectation, and love. And while I can guide, comfort, and support, the ultimate uncertainty of life and illness is something no training or expertise can erase. Story 22. Working with MyChart setups for most hospitals has given me a perspective on patient care that most people never see. It's not glamorous, and it's definitely not clinical work in the traditional sense, but it puts you at the intersection of technology, legal requirements, and patient safety. One of the things I've learned over time is just how crucial timing is when it comes to lab results and medical communication. There are strict legal requirements in place for when labs and test results need to be made available to patients. Hospitals and clinics cannot hold on to results indefinitely, and they must have systems that ensure patients get access promptly. This is partly about transparency, but it's also about safety. The minute a result is delayed, miscommunicated, or ignored, there's a risk to the patient's health. In most setups, once the lab is processed, the result is sent to the patient's MyChart account. Shortly after, a doctor or member of the care team typically calls to explain what the results mean, or at the very least, sends a secure message to provide context. This system exists so patients have some control over their health. It's a safeguard against situations like the one I recently encountered. I had a patient, let's call them Mr. S, who had been undergoing a series of tests for a chronic condition. They had been generally well, or at least unaware of how precarious their state truly was. The results came back, and if the standard communication process hadn't been followed, this patient could have gone weeks without knowing that something serious had been developing. Mr. S had no idea that any of his results were alarming. In fact, he had assumed he was fine because he felt relatively well. Many patients do this. They don't want to bother their care team, or they assume normal results mean everything is okay. Others refuse to engage unless they feel symptoms are critical, and while patient autonomy is important, it can sometimes create dangerous blind spots. In this case, the automated MyChart alert prompted him to reach out to the clinic. Because he called and listened to the care team's advice, he was able to address a situation that could have worsened rapidly if left unchecked. I like this process because it reinforces an important lesson for both patients and anyone working in healthcare. Never guess what your results mean. Even if you feel fine, you should always follow up if you're notified of lab work or imaging. It's not about fear. It's about awareness and action. In my experience, if I don't receive a call back within the day or the next, I know I need to follow up. This habit has saved patients from avoidable complications on more than one occasion. Across different clinics, I've seen cases where results got delayed, messages got missed, or calls didn't happen. Each time, it required persistent follow-up to prevent the situation from spiraling. Working in this field has also shown me just how much responsibility falls on patients themselves and how reliant the system is on their engagement. Technology can only do so much. It's the human interaction that ensures the patient truly understands what is happening and what steps need to be taken. I have seen firsthand that even a single missed call or delayed explanation can mean a patient remains in a vulnerable position longer than they should. For me, the takeaway is simple. Healthcare doesn't stop at the clinic door. Patients must stay proactive, and systems like MyChart exist to support that responsibility. By staying vigilant, following up promptly, and listening to the professionals when they reach out, patients gain control of their own care and avoid being blindsided by complications they never anticipated. It's a small window into the complexity of modern healthcare, how technology, law, and patient behavior intersect to prevent harm. And while it may seem routine to many for patients like Mr. S, timely communication was life-changing. Story 23. Last year, I had a stroke. It was terrifying and sudden. I didn't fully realize what was happening at first, but I knew something was very wrong. Luckily, the medical team identified it quickly. Within 2 hours, I was in for a thrombectomy, and the doctors were able to remove the clots. 2 clots, in fact. I survived with minimal lasting damage, and I often think about how much of that was luck and how much was the skill of the team that intervened so efficiently. The whole experience gave me a very intense perspective on medical professionals and the weight of responsibility they carry. I realized that as patients, we sometimes make assumptions about what doctors know, what they can do, or what they see. And then there are the moments when friends or loved ones ask questions that put medical professionals, or even us as survivors, into really complicated emotional territory. For example, when I got out of the hospital, a close friend called me almost immediately. They asked, "So, what exactly did they do to you? Did they cut your head open?" Now, I'm not a medical professional, but I work in IT support for public safety, and I've been on call for years. I know the toll of nights, weekends, holidays, and time missed with kids, and I know that in medical professions, it's even worse. I also understand that some questions, while well-meaning, can make someone relive terrifying moments they barely survived, or put pressure on the listener to explain things in a way that could be misinterpreted. That call from my friend was exactly that. They wanted details, and I knew answering them fully would have put both of us in a stressful, emotional place. I didn't want to lie, but I also didn't want to go into the gory technical details of a stroke and thrombectomy on a call while my friend listened with worry and panic, building with every word. So I deflected slightly, saying, "They caught it really fast, did the procedure, and I'm lucky to be here. The details are complicated, but the outcome was good." My friend pressed a little more, asking about the clots, the procedure, whether I'd have permanent problems, and if I understood what had happened. I had to carefully navigate between giving some reassurance and not turning the conversation into a replay of trauma. After I got past the initial calls and visits, I made it a personal mission to thank everyone who had helped me. I mailed a card to the doctor who performed the thrombectomy, and I included a little Toy Story claw on it. Silly, but it captured the warped mix of humor and gratitude I felt. That one doctor had saved my life over a holiday weekend, and I wanted them to know that their dedication mattered, even if it was a small gesture. I wrote to the nurses, the EMTs, and the ER staff, too. Every one of them had sacrificed time with family and friends to make sure someone like me survived. Reflecting on the whole experience, I understand why it's recommended that medical professionals don't treat friends or family. And for those of us who aren't medical professionals, it also teaches us that some questions, while well-intentioned, can be incredibly difficult to answer. My friend didn't mean harm, but their questions put me in a vulnerable spot emotionally, asking me to relive a terrifying event while they tried to satisfy curiosity. If they had asked even more detailed medical questions, I would have struggled even more to maintain composure. I realized that sometimes curiosity can feel heavy, almost like a responsibility being shifted onto someone who isn't trained to handle it. In the end, I was grateful for the experience and for surviving, but I also learned to be careful with medical questions, both as someone on the receiving end and as someone who interacts with friends or family in difficult situations. Some questions are better left unasked, or at least asked with sensitivity to the emotional weight involved. And somewhere, I hope my friend is also grateful, not just for my survival, but for the lessons about trust, boundaries, and the importance of letting professionals do their jobs while patients and families cope with what comes next. Story 24. I used to be a clinician in Australia, and one day I had an experience that perfectly captures why medical questions from friends or familiar patients can be so stressful. I was off the clock, just grabbing some groceries at the local supermarket. I was in the refrigerated section, minding my own business, when I noticed someone approaching me. My heart sank almost immediately. I recognized him as a patient I had seen at the clinic before. Not just any patient, but one I liked and had taken care of multiple times. And I knew exactly what was coming. He pulled up his shirt and I saw a large reddish lump on his torso. It looked inflamed and angry, and there were two yellowish protrusions at its edges. I don't know what had caused it. He hadn't mentioned it during any previous visits, but it was enough to trigger alarm bells instantly. He asked, in all seriousness, "Is this anything to worry about?" I froze for a second because I knew that question placed me in an extremely difficult position. He wasn't in a clinic. There was no proper examination room, no medical equipment, and no immediate support. Yet here he was, relying on my judgment. I had to make a decision quickly. I calmly told him that he needed to get to the hospital immediately. His wife, who was with him, shook her head slightly and said, "He won't go." At that moment, I realized how complicated these situations can become when someone you know personally asks a medical question. I couldn't ignore it, and I couldn't minimize it. If he stayed put, there was a real chance the situation could get worse. I asked his wife to help him sit down while I quickly retrieved my bag from the car. Once he was seated and somewhat calmer, I checked his blood pressure. It was alarmingly high, well into a dangerous range. That confirmed my suspicion that this was more than a minor problem and required immediate professional attention. I didn't hesitate. I called an ambulance right away, giving clear instructions and staying with them until the paramedics arrived. After everything was handled, the next day, I had to follow the rules for clinicians. I pulled up his medical file, documented the encounter, and logged a note about what had happened. Even then, I never got the full story about what caused the lump or the infection that followed, only that it had resulted in a significant reaction. I was left thinking about how unpredictable and uncomfortable it can be when patients, or anyone you know, ask urgent medical questions outside of a controlled environment. The situation left me emotionally drained. I was off duty, supposed to be doing something as simple as grocery shopping, and yet I was suddenly responsible for making high-stakes medical decisions on the spot. It reminded me that doctors carry responsibility everywhere we go, whether we like it or not. That day, I realized how challenging it is to balance concern for a friend or a familiar member with the legal, ethical, and professional requirements of providing care. Reflecting on this, I can say I would rather never be asked a question like that outside a proper medical setting again. I needed to act fast, make judgment calls without full information, and hope that my decisions protected the patient while avoiding any unintended harm. It's exactly the kind of situation that the topic, "Doctors of Reddit, what is a medical question a friend has asked you that you wish they hadn't?" is talking about. Sometimes, being asked a simple question like, "Is this anything to worry about?" can place enormous pressure on a clinician, emotionally and professionally. Even now, I think back on that day and feel both relieved and frustrated. Relieved that the patient received urgent care and didn't come to further harm, and frustrated at how unpredictable it can be when someone bypasses the proper medical channels and comes directly to you, expecting instant answers. It's a vivid reminder that sometimes the worst part of being a medical professional isn't the emergencies in the hospital. It's the ones that follow you into everyday life, completely unexpected. Story 25. About 15 years ago, my mom, a former RN, called me on a seemingly ordinary day. She asked me to look up some medical terms for her when I got home. At the time, I didn't think much of it. It sounded like typical curiosity from someone who spent her career in healthcare. I got home, opened my laptop, and started researching. As I scrolled through pages, a sinking feeling began to grow. The terms she had asked about, they weren't just benign medical jargon. They pointed directly toward colon cancer. I froze. My mind raced through memories of her over the years, moments where she brushed off abdominal pain, a persistent fatigue she never fully explained, the occasional checkup where she smiled and said she was fine. Now, it all made sense in a terrifying, overwhelming way. I knew I was sitting on information that could change the course of our lives, yet I didn't know how to approach her. Thankfully, the doctors had caught it early enough that surgery was an option. She went through it, and from what I could gather, the operation was successful. But about 10 years later, there was a recurrence. Surgery again, and while she recovered, I could see the toll it took on her health. She became quieter about her symptoms, more guarded. It wasn't that she didn't trust me. It was her way of protecting both herself and me. She refused to give details to anyone, letting me piece together what I could. And so, for the past 15 years, I've been bracing for impact. Every call, every casual comment about feeling unwell sends a small wave of fear through me. I am not a healthcare professional, and that makes this even more complicated. I had the knowledge and the ability to research, but not the authority or experience to interpret her situation fully. I couldn't call her doctor, demand answers, or truly advocate for her in a clinical sense. I was simply her child, trying to make sense of medical information while holding back panic and trying to maintain normalcy. Every bit of knowledge I gained felt like both a blessing and a curse. I could act quickly if something went wrong, but it also meant I carried the emotional weight alone. Watching films like The Farewell always hits me hard. That story, about a woman whose grandmother in China has cancer, but the family refuses to tell her, is deeply resonant. I understand the cultural context, yet I also know the heartbreak of being in a position where knowledge exists, but sharing it is complicated. I would hate to have that knowledge and not say anything, or to be in a position where someone I love is hiding the truth from me. I've lived with a smaller, subtler version of that fear for years, knowing, watching, waiting, and sometimes holding my tongue to respect her boundaries. Being asked to look up those terms that day was simple enough on the surface, a harmless favor from my mom. But in reality, it placed me in a situation I wish I hadn't been in. It forced me to confront the fragility of life and the weight of knowing medical truths without the tools to act decisively. It also made me recognize how differently people handle health information. Some want to know every detail. Others, like my mom, choose to protect themselves by controlling how much they share. I learned painfully that sometimes knowledge can feel like a burden rather than power. Over the years, I've tried to find a balance. I check in often, I listen carefully, and I watch for signs that something may be wrong, but I never push beyond what she is willing to share. It's a delicate dance, staying informed without becoming overbearing, caring without invading privacy. I've realized that being trusted with medical knowledge in a personal context is its own responsibility, separate from any professional obligation. And it can be just as challenging emotionally as any clinical scenario. Ultimately, I wish my mom hadn't asked me to look up those terms. It would have spared me years of constant vigilance, silent anxiety, and emotional weight. But at the same time, I'm grateful I was able to act when needed, even if it was just to quietly observe and be ready. It's a strange, complicated gift, the knowledge that allows you to protect someone, and the awareness that sometimes that knowledge is a heavy cross to bear alone. Thank you for watching. If you enjoyed this video, be sure to give it a thumbs up, subscribe, and hit the bell icon so you never miss an update.